lined by columnar epithelium. Okay, columnar epithelium. This is one gland, but okay, what is this? This is a secretory product. Secretory product. Okay, secreted by the gland or by the cells, by the epithelium. So, what do you call this? Epithelium, endometrium. Okay, this is your secretory endometrium. Okay, you have several stages. Of course, in days. Okay, it also has its morphologic features depending on the day of your secretory endometrium. In 16, okay, 16, 17, you will see still see your subnuclear population. I hope I know Dr. Lopez emphasizes this, and this is somewhere in the late secretory endometrium. Okay, wherein you'll see also clustering of blood vessels and somewhat pre-residual changes here. Okay, secretory endometrium. Next is F0905. Let's look at this. Okay. What do you think? What is this structure here? Ano tong structure na to? What is this structure? Villi, okay. Actually, this is a shortened or stunted mucosal plicae of your fallopian tube. Okay, it's shortened. Why? Because if you look around, you'll notice that your fallopian tube, this is actually the entire, the lumen of your fallopian tube is dilated. So the part of your plicae in mucosa is flattened already. This one. Okay. Why is it dilated? Let's look around. Okay, so you see blood clots here, but what are these structures here? Anybody like to guess what are these structures here? Ano to? Ano to? These are chorionic villi. Okay, immature chorionic villi. So, when you see chorionic villi, these are, and of course, surrounding this villi here are this blood clots. Okay? So if you see this inside the lumen of the fallopian tube, your impression is what? Ectopic pregnancy. Okay? Or tubal pregnancy. Okay, so this is a case of tubal pregnancy. Okay, ectopic or chorionic villi inside the fallopian tube. Okay, next will be M1401. Then let's scan around. This is a big chunk of tissue. Okay, let us look at the surface. There's no lining epithelium. Okay. But what is this? Anybody? What is the tissue? Anybody? What is the tissue? Higher magnification. Okay. Pag ito lang nakita nyo, ano tissue to? Ano? endometrial tissues, okay? Because those are glands, okay, endometrial glands, and the stroma is characteristic. And going back, let's go at scanning magnification. But what is the tissue around it? Ano ba itong tissue around this endometrium? Okay, so eye magnification, okay? Ano yan? Smooth muscle, okay? So around this endometrium are smooth muscle tissues, okay? So when you see smooth muscle tissues or your myometrium, when you see endometrium inside or within your myometrial layer, okay, what is now your diagnosis? Adenomyosis, okay? Adenomyosis, okay? Endometrial tissue within the myometrium. Okay, let's look at in scanning magnification. This is one adenomyosis, another one, okay? This is a gland plus another one. Okay, so another one, this is adenomyosis. Okay? Okay, this one. Okay, look at this. What is the tissue here? Eye magnification. What is the tissue? Smooth muscle. Look at the tissue. It's streaming. It is only in one direction. Mahaba lang siya. Like this one. Halos pahaba siya, di ba? Okay, they are elongated. Okay. So let's go back. Low magnification. But look at this one. There's a space. This is a space. Okay. And this one is your myometrium, but this is another tissue. What is the tissue? The same. Smooth muscle. But if you look at closely, okay, the previous one shows a unidirectional pattern or unidirectional, one direction lang yung smooth muscle. But here, look at this one. So, the smooth muscles, the muscle tissues are seen in different direction. Okay, this one is going upwards, and this one going diagonally. Okay, and some are cross sections. Okay, these are cross sections. Okay, particularly this one. Okay, so the pattern of this smooth muscle is what we call your interweaving pattern. Okay, iba-ibang direction. So again, with this, okay, what is your diagnosis? Okay, this is leiomyoma. And if you trace this, okay, there's a space. Okay, if you can trace the border of this leiomyoma. Okay, if you can trace this, this is what you call your well-differentiated pattern. Okay, see here, you can look at the difference between the normal myometrium and this leiomyoma. Okay, you see a definite border. Okay, so this is well circumscribed. Okay, and if you go closely, okay, you won't see any mitosis. Okay, there will be no atypia. Almost all the nuclei are the same. They are elongated. Okay, and the sizes are almost the same. Okay. Next will be 1402. Endometrial cyst. When you say endometrial cyst, it is a cyst lined by what? Lined by endometrial tissues. Okay. So, as a criteria, okay, you can have three different lining of the endometrial cyst. Okay, one is this could be lined by your endometrial epithelium or glands. It can be lined by endometrial stroma, or sometimes it is lined by your hemosiderophages, okay, hemosiderin-laden macrophages. To diagnose endometrial cyst, the two of the component, okay, two linings should be present. Okay. Either this is lined by endometrial epithelium or hemosiderophages, or hemosiderophages plus endometrial stroma. Okay. So this is the cyst. Okay. And of course, the red areas there, it is hemorrhagic. At high magnification, what is the lining? Okay. Here, it's called columnar. This is endometrial epithelium. Okay. And of course, you also see endometrial stroma, okay, underneath the epithelium here. Yeah. Let us see if there are some hemosiderophages. Okay, it's not quite obvious here, but grossly, your endometrial cyst is a cyst, a dilated cyst that is lined by, that is filled with, usually it is filled with chocolate brown, chocolate-like material. You can call, sometimes you can call this your chocolate cyst. Okay. So, again, this is your cyst lined by stroma. This is endometrial stroma. Okay. Hemosiderophages are sometimes looked at in the lining because of the constant hemorrhage that is happening in the lining of the cyst. Okay, that's your endometrial cyst. Next slide, 06. 014 06 014 06. Okay. What is this? This is a cyst. Okay. Cyst wall lined by, look at this epithelium. Okay. This is an epithelium. Let's look at this epithelium at high magnification. What is the lining? Anybody would like to describe the epithelium? This one? Okay, probably we'll look for a better epithelium. An area. Okay, this one. Anybody would like to describe the epithelium? This one? Anong kamukha ng epithelium? Also this one is epithelium. Okay, what's the lookalike of this epithelium? Okay, this one. Medyo na-detach siya. This one, this epithelium. Okay, tall columnar and basally oriented. Okay, so this epithelium is similar. You've seen this in what area? Sa endocervix. So this epithelium is lining a cyst in the ovary. So you call this cyst your mucinous cyst. Okay? Depending on the gross picture of the cyst, if it is only a unilocular cyst, only one cyst, call this mucinous cyst. If you see several cysts, okay, or multiloculated cysts, you can already call this now mucinous cyst adenoma already. Okay. And this is okay. It has stages. The next stage of mucinous cyst adenoma is there's stratification of your nuclei. You call this now your borderline mucinous tumor or low malignant potential. Mucinous cyst of low malignant potential. But if you see necrosis, stromal invasion, you call this now mucinous cyst adenocarcinoma. Okay, but this one, the lining epithelium is just a simple columnar epithelium. There's no stratification. This is benign. You call this either mucinous cyst or mucinous cyst adenoma. Okay, number 15. This is an ovary. What is this? What's the lining epithelium here? Ano? Lining epithelium. Diba? Stratified squamous. Is it normal in the ovary? No. Okay? At low magnification, see, this stratified squamous epithelium is accompanied by what structures are this? Anong structure siya? Sebaceous glands. Okay? So, because of this, these sebaceous glands continues to secrete sebum or sebaceous material in the cyst. Okay? And you have skin adnexate. Sometimes, okay, you see this one is a hair follicle. You will see hair. Okay. What is your diagnosis? Teratoma. Okay, but only in mature cystic teratoma, you don't only see skin tissues like this one. You will also see different tissues from different germ cell layer. Okay. Again, this one you will see fat cells here, adipose tissue. This one, what is this? Blue area here. Malapit na sa bone. Cartilage. Okay, you will see cartilage. Okay, of course you will see. Sometimes you will see bone. This one is this is your bony tissue. This one, bony tissue, osteoid. Okay, so sometimes you will see brain tissue. Okay? But if you see neural tissues in teratoma, what will you call this now? Neural tissues. Because neural tissues is a sign of immaturity. Okay? You see that in embryology. Okay? Neural tissues, depending on the amount of these neural tissues. And also, if you see immature tissues like immature cartilage, okay, you call this immature teratoma. Okay? It is already leaning towards malignancy. Okay? Immature teratoma. Okay, last slide. What is the lining epithelium here? Stratified squamous epithelium seen in vaginal vault, okay, vaginal wall. Okay, so this is made up of your stratified squamous epithelium, thickened stratified squamous epithelium with associated, this one, what's this? Okay, keratin, hyperkeratosis, this one. And if you look at the surface of the stratified squamous cell, okay, stratified squamous epithelium, what are these cells? Okay, these are your typical koilocytes, okay? Cells with vacuolated cytoplasm, and in some the nuclei is crumpled or brood-like, eccentrically located. Those are your koilocytes. So this is a sexually transmitted tumor, your condyloma acuminata. Okay? Acuminatum. It's singular. Acuminatum. And what's the causative virus? HPV. Okay? That's your condyloma. So later on, if you have your individual microscope, okay, then in your next meeting, you can just review individually these slides. Okay?